Hi guys, welcome back to my channel. If you're new here, my name is Raina. I am 26 years old and I am a new mom to a 4-month-old baby girl who is also my rainbow baby. So today I decided to do a video on my birth story with my rainbow baby. So I do plan on doing a birth story about my first daughter, who, if you guys didn't know, she unfortunately passed away, and we had a stillbirth last July in 2018, and I am planning on doing that birth story as well. I'm just wanting to talk to my husband about it and just kind of see what all he's comfortable with me sharing, obviously because the experience was very intense, it's very personal, but I would like to share that story as well. And if you can hear my daughter, she is beside me at the moment, so I'm just going to be passing her toys periodically throughout this video to keep her entertained. So, my birth story with my daughter. So, I got pregnant in, if we go back in dates, in November of 2018, which was about 3 months after my stillbirth. And the pregnancy was hard. It was not an easy pregnancy. I was sick for a lot of the pregnancy at the very beginning, and then I think I had a few months in the second trimester that were easier, which I guess can be common, that you feel better in the second trimester. And then near the end of the second trimester, beginning of the third trimester, I started having like really bad back pain. I wasn't able to get much sleep. I was having a lot of anxiety because of the situation with my firstborn and the stillbirth and everything around that, and emotions. So that was quite difficult. I ended up leaving work early on, when did I leave work? Beginning of June. And I was on medical leave. So now let's talk about labor and when that started. So I went into labor on the morning of August 25th it was pretty much exactly 5 a.m. I woke up with contractions, and I had had a few false labors before this day happened, so I didn't think much of it. I didn't think it was real labor because I had had Braxton Hicks, I had had contractions. Oh, I should also mention I was 41 weeks, and at this point I was exactly 41 weeks on the 25th of August. And I had had 3 membrane sweeps up to this point. This was a Sunday, I believe. Was it a Sunday? I think it was a Sunday. I might be wrong, but I think it was a Sunday. And I was scheduled to have a ultrasound and a non-stress test the Monday because I was 41 weeks. And so I started having contractions at about 5 a.m. and like I said, I didn't take it seriously, but I woke up my husband and I said, hey, just so you know, this is what's going on. I'm going to start timing them and, you know, try and get some more sleep if I can. But it was obviously different as the hours went by. Like I think by 7 a.m. or 8 a.m. my mom woke up and my husband woke up for the day. My mom was in town visiting to help me and be support through my labor. So they woke up, they were getting coffee ready and breakfast ready, and the contractions were, I would say, pretty consistent. I can't remember exactly at the beginning how far apart they were. I want to say it was like somewhere between like 15 and 10 minutes apart for most of the morning. And I remember that my midwife had said that if they were closer together and getting more intense, then it was probably the real deal and not the false labors that I was having before. She also told me to try having a bath or changing positions, and if my contractions changed or slowed down with doing those things, then it probably wasn't real labor. So I'm pretty sure I went and had a bath at like 9 a.m. So I had been having contractions for about 4 hours. I had a bath and had contractions throughout my bath, and then I got out and then I tried to lay down, and I remember the contractions just kept coming and coming. I tried to have a nap and stuff, and that was not going to happen. So I knew that this was real labor. I want to say probably closer to lunchtime, maybe between noon and 2. I knew it was labor, and my mom was like, yep, you're definitely in labor. So we kind of just got bags ready. They were already ready, but I guess we just kind of went through things, made sure we had everything we needed, make sure my mom had everything she needed, because we were packed, but obviously she wasn't. We didn't know, right? So we just wanted to make sure we had everything. So I labored at home from 5 a.m. until about 4 o'clock. We called my midwife because the contractions were getting a lot closer together, but they were still kind of in the range of 6 minutes apart or so, and they were definitely lasting a minute long for sure. So we called my midwife and we explained to her what was going on, and I was planning on, I did have a midwife like I just said, and I was planning on giving birth at our birth center. Well, my midwife clinic has a birth suite, so we were planning on birthing there, so I wanted to call her and let her know what was going on. I also live like 40 minutes outside of my town, so I wanted to make sure I had enough time to drive in. So she's teething, by the way, so that's why she's crabby. But she's been fed and she just had a nap, but she's teething, aren't you? Aren't you? So my midwife said, without examining me, she's not sure obviously if I'm progressing. And up to this point I had been 1 centimeter dilated, and my baby had never dropped down into my, what do they call that, my birth canal, at all of my appointments. Even when I got all my sweeps, she still had never dropped. So she was saying, it sounds like real labor. So she said, come on in, we'll meet at the birth center. It's my dog. And we will check you and see where you're at. And I said, okay. And she said, even if you're still at the beginning stages, just come in anyway. So we drove in, like I said, it was about a 45-minute drive. So by the time we got into town and met my midwife there, it was about 5:30-ish, 5:45 maybe. And she checked me and I was 5 centimeters. So I had done 4 centimeters by myself in the span of 12 hours. So I thought that was pretty good. I was proud of myself. So she's like, yep, it's labor. But she also noted that my baby still had not dropped. But she said that was okay still. She wasn't concerned about it at that point. So we weren't making a big deal out of it yet. I know, there you go. So we weren't making a big deal about that yet. So she said, stay here at the birth suite and labor for a while. I'm gonna go home and sleep now. She only lived 2 minutes away from the midwife clinic. And she said, call me back when things get really intense and I'll be here in 5 minutes. So, well, because first time babies, they expect you to take a lot longer. So we stayed there and I labored for quite a while. And I wanna say around 11 p.m., we called her back because my contractions were getting very, very bad. I was having back labor. I was throwing up a lot. I was very, very uncomfortable, as you would imagine. So we called her back at 11 or 11:30 p.m. and she came within a few minutes and she checked me again, and I was, at this point, I think I was 7 centimeters, but my baby had still not dropped and was not engaged. So at this point, she was getting a little bit more concerned. And then also I was having, I can't remember what she called it. I think she called the contractions that I was having like doubled up contractions or something, like, or she was saying that they were doubling up, because what would happen is I would have one really long, really painful contraction, and then immediately after I would have a really short, not very painful contraction. And then there would be a huge gap, and then I would have the really big contraction, the small contraction, big gap. And I had that pretty much, I only started having that when I got to the birth center. So I had that going for, that would have been like 4 hours, 5 hours. And so she thought that that was kind of something to note. So she was a little bit concerned. So she started to think that it was maybe a position that the baby was in, like maybe she was hitting my pelvic bone, and that was why, one, she wouldn't drop, and two, would cause these doubling up of contractions or whatever she called them. So at that point, which this would have been 11:30 at night, nearly midnight, she told me it was up to me what I wanted to do, because I had been in labor since about 5 a.m. and I was exhausted. Obviously, I haven't slept any of this time, and labor's very hard. So she said, it's up to you. What would you like to do? Do you want to continue to labor here? Or do you want to go to the hospital? What do you want to do? And as much as I wanted to have an all-natural birth at the midwife clinic, I myself was concerned because she had not yet dropped, and I was 7.5 centimeters, and these double up of contractions, you know, she was saying it's not consistent, something position wise might be difficult, it might make pushing painful, blah blah blah. So in my head I was like, you know what, with already the way things are going, I was like, let's just go to the hospital now, which was a 2-minute drive from the birth center, and let's just go get checked in just in case, because I can go natural there, or if we need help, the people are there anyway. I didn't want it to be an emergency thing when I'm trying to push. So we went to the hospital, and we got to the hospital just after midnight, got up to our room, and when they first get you into a room, it kind of takes them a bit to come and take all your vitals and get your IV hooked up and, you know, kind of come in and assess exactly what you want. And at this point, I was probably closer to 8 centimeters, or I was 8 centimeters when I got to the hospital. And so I was begging for pain relief, and they kind of took their time, which was a little irritating, but I know that they were busy. They did tell me that they were busy in the labor and delivery ward. But I did get gas, like gas and air or whatever, laughing gas was the first thing they gave me. And let me tell you, that stuff is great, but it doesn't stop the pain. So I'm, you know, pulling on this thing, huffing on this thing, and still screaming as I'm doing it. So it was really, really painful. And I was still having the doubling up of contractions. So they gave me that for starters, and then pretty sure the midwife, she was trying to make arrangements with the OB that was on call and everything. So the OB, which was luckily a woman, I felt really thankful, on call, she came in with my midwife and they examined me, and I was 8 centimeters at this point. She also noted that my bag of water was bulging and it appeared to be quite large, and her theory, the OB's theory, was that my baby couldn't come down because of the bag of water. So I don't know if that's common or not. I'd never heard of that. So she said she would like to break my water, and asked me if I wanted an epidural. And I had always said never would I ever get an epidural, but I was in so much pain, and I was, I was just terrified. So I said I wanted an epidural. So they got me an epidural, and then not long after I got the epidural and they did my catheter, she came in and she broke my water, and there was a ton of fluid. She said there was a ton of fluid. And as soon as, because she wanted to guide the baby down, she said, when she broke my water, and she said as soon as she broke my water, my baby's head came right down into my birth canal, because up to this point, even at 8 centimeters, she had never dropped. So she was like floating up in my tummy, and then all of a sudden she just went right down into my birth canal. So her head was there, so that's good. And so they think that that's what it was, which is strange, but they think that that's what it was. And so I had my epidural, and that went fine. Honestly, the epidural didn't hurt because I was in so much pain with labor that the epidural didn't hurt. So I had the epidural, and then they kind of just let you labor for a bit, like laying there, and my contractions did slow down a little bit, but I was still having some doubling of contractions. So they did give me some, I'm gonna say it was Pitocin, just to keep the contractions regular and to speed it up, I guess, because sometimes an epidural can slow stuff down. So they did do that, and I was monitored. I had a nurse sitting at my monitor thing to measure to keep track of the heart rate and everything. She was there the whole rest of the time after I got the epidural. I'm not sure if that's standard or not, but she was there the whole time. And at one point, her heart rate started to drop every time I would have a contraction. And I was probably like 9 centimeters. It would start to drop when I would have contractions. And it was like, not a terrible drop, but it was like enough for them to note it. And she called my midwife in, because my midwife would go and try and nap and come back, and nap and come back. And so they were just kind of monitoring it. And then when I was I was 10 centimeters, they said, okay, let's do some practice pushes before the OB gets in here and see how this goes, like how you push. So we got everything ready, and I pushed the first time, and her heart rate went drastically low. And so they were very concerned, and they said, okay, the OB's on her way. Let's just do a couple more pushes and just see what happens. They didn't think the cord was in the way because the OB, she guided her down and she didn't feel anything cord wise. And every time I pushed, her heart rate went drastically low. So a bunch of nurses came in. My midwife was there, obviously, and then the OB came in. And I think I did 2 pushes for the OB, and her heart rate just kept going lower and lower and lower, and to the point where the midwife said, okay, if we don't want this to turn into a C-section, we need to get this baby out right now. So she said, Raina, this is serious. You need to get this baby out. And she said, I would like to assist you with a vacuum to get her out as soon as possible so this doesn't turn into an emergency C-section. And I said, okay. And I wasn't panicking at this point because I had a really good OB and my midwife was there. I felt really supported. And then I had an older nurse like come beside me, and she was kind of coaching me through the pushing, which I found really helpful, and everybody was very kind. And even though I knew it was serious, they made me feel very calm, like we had this. So I started pushing, and then I'm guessing when her head started to come out, I think that's when they put on the vacuum. I don't know how it works. I couldn't see anything. I was just focused on pushing. And we ended up getting her out within 20 minutes of pushing. And she was born at 5:25 a.m. on the 26th of August. So pretty much exactly 24 hours after my contraction started, she was born via vacuum assist. She came out real fast, and because of that, I had a 2nd-degree tear, which they stitched up, and because I had the epidural, I didn't feel anything really, thankfully. And so I'm trying to think what else happened. Yeah, so she stitched me up. They put her on my chest. You know, she immediately nursed, and she nursed amazing. And I had no idea because my previous birth was such a different experience, my stillbirth. But like, I didn't know your placenta came out so quickly when you have like a full term birth. So that all came out fast, and I was just so shocked how quickly it all wrapped up. And I kind of had this moment after she was born, like not shock, but like, you know, kind of, that I had this huge belly because I was huge, and then all of a sudden I had this flabby belly, and she was out, and they were done with me. The placenta was out, I was stitched, I was good to go, and I had this baby now. And so it was such a surreal moment, and it was very emotional, and we were so glad that she came out and she was fine. And so that was her birth. It was, you know, it wasn't a bad birth. I don't have any regrets or ill feelings about it. I know some people, when they don't get the home birth they wanted, or their, what's it called? Their, what do they call it now? Pain-free, or medical, I don't know, without medical intervention, because I did, and I didn't want that at first, but I didn't have any regrets about it. I didn't have any ill feelings about it, because there obviously was some issues, and afterwards my midwife and I were talking about it, and if I had had those symptoms right up to when I started pushing, like the doubling, the pain, the bulging of the water, she said she would have wanted to take me to the hospital eventually anyways. So we made the right decision sooner, which I felt confident about, and I was like thankful that I trusted my instincts. And so for me, it all worked out. I had a healthy baby at the end, and I was fine. So that was our birth story, and it was good. And she's here, and she was healthy, and everything was good. She weighed 7 pounds, 14 ounces, and was 21 inches long. And yeah, my husband and my mom were with me for my support, and it was an overall good experience, and we couldn't be happier. So that was my birth story. If you guys enjoyed hearing this birth story, please give me a like and leave me any comments. I do plan on doing my stillbirth story, like I said, with my first daughter, Miri, and hopefully you guys will see that video soon. And as always, thanks for watching, and have a great day.